Wilson, and I'm a public health professional. So I work at the Tacoma-Pierce County Health Department, and I'm a program analyst. And so my role is in assessment planning and development. And my work involves a variety of different tasks. So data collection and analysis, designing and conducting evaluations, county-wide assessments, and I work with a team of epidemiologists, program analysts, and health promotion coordinators. So I think one of the things that I love about public health is that we really focus on the health of all people in our county. And so what we do to achieve those is through our priorities. And our priorities currently at the health department are people are healthy and safe, people have equitable opportunities for health, and children, families, and communities thrive. So I love it here. What are the symptoms of COVID-19? Well, people with COVID-19 have a wide range of symptoms. So some people, about 40% who test positive for the virus, have no symptoms. You may have heard these people referred to as asymptomatic. So they can still transmit the virus to others, but they don't have any symptoms. When the virus does cause symptoms, the most common ones are fever, body aches, dry cough, fatigue, chills, headache, sore throat, loss of appetite, and loss of smell. So, and then symptoms appear between 2 and 4 days after exposure to the virus, but most people will develop symptoms between 4 and 6 days after exposure. Prevention measures on this infographic, right? Washing your hands for 20 seconds, cover your cough, do not touch your face or cloth mask, and avoid contact with anyone who's been sick or ill. The number of new reported COVID cases shown on a graph. So as you can see here, it forms a curve as we track the numbers of new cases over time. The more new cases reported each day, the steeper the curve. So you'll see here, as it's highlighted for a pandemic outbreak with no intervention, it is really just accelerating at a very high rate. So when public health uses the phrase flattening the curve, we are talking about slowing the number of new cases. One important reason we want to slow the acceleration or flatten the curve is to reduce the demand on hospitals and healthcare infrastructure. So we work together to lower the numbers of daily new cases by preventing the spread of COVID-19. And then, of course, as I mentioned before, the best way to achieve this is as a community by staying home as much as we can, staying 6 feet apart, wearing masks, in face coverings when you're in public, and all of those prevention strategies that we just talked about: washing your hands, avoiding people who are sick, wearing a mask, and staying 6 feet away. They're really beneficial, but they're only beneficial if they're worn correctly. So I think I have another infographic that I'll share with you. So let's see if we can zoom in on this. So they need to cover your nose and mouth and be secure under your chin. So they also really are not effective with exhalation valves or vents because they're not going to be helpful to prevent the spread of COVID-19 to others. So they limit the transmission, and I don't have a good graphic of that, but of the droplets that you could spread. And so droplets frequently spread when you talk, laugh, sneeze, or breathe. So you could have a virus that causes COVID-19 and not know it. As we mentioned before, there's 40% of those people who are going to not have any symptoms, and so they may not know that they're COVID-19 positive. So face covering is also going to offer protection from receiving droplets from others and from putting those droplets out so that others might pick those droplets up. A CDC reference right here. So this is some of the information that the Centers for Disease Control and Prevention puts out on a 14-day quarantine. So an incubation period, just to get kind of our vocabulary, is the time between when you've been exposed to the virus and when you get sick. And the incubation period is different for different diseases. So for COVID-19, it ranges from 2 to 14 days or 2 weeks. The 2-week or 14-day incubation period is important to understand for those who need to quarantine. And then quarantine is used to keep someone who might have been exposed to COVID-19 away from others. This is different from isolation, which keeps someone who's infected with the virus that causes COVID-19 away from others, even in their home. So incubation is for someone who's infected with the virus. Quarantine is for someone who might have been exposed. And so quarantine helps prevent the spread of disease that can occur before a person knows they're sick, or if they are infected with the virus without feeling any symptoms. Again, it's that asymptomatic. And it can take up to 14 days after you've been exposed to the virus for a person to develop COVID-19 symptoms. So a negative test result before the end of 14-day quarantine period does not necessarily rule out possible infection. By quarantining for 14 days, you lower your chance of possibly exposing others to COVID-19. So that is why it is important for us to keep a 14-day quarantine period. And the benefit of that is that people with COVID-19 can still spread the virus even if they don't have any symptoms. So if you're quarantining, you're not out in our community spreading the virus. And COVID. So one of the things that that we know is that flu and COVID share many symptoms. So cough, fever, sore throat, and body aches. So one of the things that we're focusing on, because there are so many shared symptoms, is how you can protect yourself and your family by getting a flu shot. So it's important because we don't have a vaccine yet for COVID-19. And if you can stop from getting the flu, you're going to be able to alleviate our healthcare system, who is also still dealing with COVID-19. So getting a flu shot helps with stopping you from getting the flu, or potentially your illness will be milder and shorter if you do get the flu, and it protects you from, it protects those around you all season. So one of the other differences between COVID-19 and flu is that there are different high-risk categories. So as I mentioned before, the high-risk categories for COVID-19 are anyone who's living in a care facility, who's 65 and older, or who has an underlying health condition. Those are what we defined as high risk. Those at high risk for severe illness for flu are children younger than 5, especially younger than 2. Again, the 65 and older, people living with chronic conditions, so some of those underlying health conditions, but also pregnant women. So this is really an important step to expand those protective, that type of protective prevention measures for not just the high risk in COVID, but also younger children and pregnant women. First, I would say know your facts, right? Over the summer, a male from Pierce County became the first person younger than 20 without an underlying health condition in Washington state to die of COVID-19. So young people do experience severe outcomes, although it's just less than older people. Second, I think you need to understand that COVID-19 is different for different people. And so you may get COVID-19 and not have any symptoms. But if you don't stay put while you should be isolating or in quarantine, you could give COVID-19 to your parents, to your aunts and uncles, to your grandparents, to some elder in your community, and they won't necessarily fare as well as healthier, younger you. As I mentioned before, I mean, there are just some really simple ways to protect yourself and your family and your neighbors. Wear a mask, limit your interactions, so a small circle of friends and family, stay 6 feet apart, wash your hands, and get tested if you think you were exposed. And then lastly, I think my piece of advice would be that we have talked a lot at the health department about social distancing, and that does not mean social isolation. So being socially connected is important for your health, as well as eating healthy and exercising. There are safe ways to remain socially connected, and that's important. So whether that's video chatting with your friends and family, watching online events together, tuning into live streams, YouTube channels, social media, anything that you can do within those parameters of staying socially distanced, I would encourage young people to do, because I think that keeping that social connection is important.